Polio or poliomyelitis is a disabling and life-threatening disease caused by the poliovirus. Polio is caused by one of three types of poliovirus which are members of the enteroviral genus. Based on the research, the history of polio infection began during the prehistory, when ancient Egyptian paintings and carvings portrays otherwise healthy people with withered limbs and children walking with canes at a young age. Although major polio epidemics were unknown before the 20th century, the disease has caused paralysis and death for much of human history. For transmission, polio is a highly infectious illness that spreads through contact between people, by nasal and oral secretions, and by contact with contaminated feces. Poliovirus enters the body through the mouth, multiplying along the way to the digestive tract, where it further multiplies. An infected person may spread the virus to others immediately before and up to 2 weeks after symptoms appear. The virus can live in an infected person's feces for many weeks. It can contaminate food and water in unsanitary conditions. People who don't have symptoms can still pass the virus to others and make them sick. The polio cases can be divided into three types, which are abortive polio, non-paralytic polio, and paralytic polio. For abortive polio, in these cases, polio is a mild illness with viral-like symptoms such as fever, fatigue, headache, sore throat, nausea, and diarrhea. For non-paralytic polio, these cases typically involve the symptoms of abortive polio with additional neurological symptoms such as sensitivity to light and neck stiffness. For paralytic polio, the first signs of paralytic polio after an initial period of viral-like symptoms typically begin with loss of superficial reflexes and muscle pain and spasms. Paralysis is the most serious symptom associated with polio because it can lead to permanent disability and death. Between 2 and 10 out of 100 people who have paralysis from poliovirus infection die because the virus affects the muscles that help them breathe. In about 95% of all polio cases, the person has no symptoms at all. These are known as asymptomatic cases. Even children who seem to fully recover can develop new muscle, pain, weakness, or paralysis as adults, 15 to 40 years later. This is called as post-polio syndrome. For treatment, polio has no cure, so prevention is the most effective means to combat it. Certain drugs and therapies can offer supportive care for patients to counter some of the effects of muscle involvement. Patients who progress to paralysis of muscle involved in breathing receive artificial breathing support, which may be discontinued if the patient regains use of the affected muscle. For the vaccines, there are two types of vaccine that can prevent polio. The first is an inactivated poliovirus vaccines or IPV given as an injection in the leg or arms depending on the patient's age. The second is an oral poliovirus vaccines or OPV is still used throughout much of the world. Oral polio vaccines contains an weakened vaccine virus activating an immune response in the body. When a child is immunized with OPV, the weakened vaccine virus replicates in the intestine for a limited period, thereby developing immunity by building up antibodies. It is very important for the infants and the children to be vaccinated with the polio vaccine because it can protect children by preparing their bodies to fight the poliovirus. Almost all children who get all the recommended doses of the inactivated polio vaccine will be protected from the polio.